All right. You want to know how HSAs work. They seem more complicated than they really are. There's two components, okay? Let's talk about the first component. The first component is the insurance plan, the insurance card that you're going to be carrying with you. Okay, on the insurance plan. It's usually built on a chassis or a type of plan that is like a PPO plan. The only thing is with this plan is a little different. And I'm talking about plans here in the US, okay? The high deductible health plans require them to have an HSA account attached to meet a minimum deductible and a minimum out of pocket. So you're going to notice that, let's say if you're offered a PPO versus an HSA, obviously an HSA plan is going to have that higher deductible. It's kind of like car insurance in a sense. The higher the deductible, usually the less the premium is every paycheck, right? Same thing concept in this plan. I'm not sure what your premiums are at work. I just know in plan design, these plans tend to have the higher deductible. A second thing that they have is that they don't have no copays. So in most cases, okay, now preventative care obviously is covered at 100%. I'm talking about well woman, well child, well man, any immunizations, PSA tests, mammograms, things that are screenings and have no symptom. Those things are covered at 100%. You're not worried about those. It's when you get injured or you get sick and you have to go to an office visit, inpatient, outpatient, a lab, an x-ray. On an HSA plan, you have to meet that deductible, okay? Every area has a percentage, but before the percentage means you got to meet a deductible. In some areas, you may have copays. In some plans, I've seen that have 100% after you meet the deductible. So look at your plan summaries. That's the most important. But you meet the deductible, and in most cases, then the plan starts sharing. And I'm talking about even prescriptions. So for a higher deductible, if you're on a high costing medication, you want to consider that as well. So take a look and see, call the carrier, find out how much are these items going to cost me, right? This is the doctor that I see. This is how often I see him. Ask them, and they'll be able to tell you more or less how much it's going to be of that deductible. In most cases, employers actually contribute into your health savings account to put away some money to help you with those first dollars of expenses. So we're talking about the health plan. Health plan usually has a deductible. It has to be satisfied. Then afterwards, it either goes into co-insurance, co-pays, or it might be at 100%. Some plans do that. But once you reach the out-of-pocket max, that's it. Now, these can be different for an individual participating by themselves versus a family. So you really need to take a good look at the plan summary to find out what is the deductible for a family. Sometimes the individual deductible may apply depending on the amount that it is for an individual in a family. Or it might be the family deductible, like on this last plan I explained. They had to satisfy the full family deductible. One person getting ill had to satisfy that whole amount before the plan started covering that particular person at 100%. Now, your plan summaries are going to tell you how it's going to work on a family plan. So whether it's a family deductible that has to be aggregated all together, satisfied even by one or by all, and then the co-insurance that applies after that up to the out-of-pocket maximum. Usually on the out-of-pocket maximum, there is an individual within a family that once they meet that, that's it. They tap out, plan covers at 100%. Now, when I'm talking about these, I'm talking about these as in-network. There's also an out-of-network feature on these plans, just so you know. And usually it's a higher deductible, it's a higher percentage, it's a higher out-of-pocket max. So keep that in mind. Now, I'm going to have a second video to explain the health savings account attached to this high deductible health plan. So go look for that one. So many things that can happen in our health that sometimes we don't quite understand, but there's something that can help support your immune system and you might not know about it. That's where I specialize in that. Click the link below and you'll be able to get more information on this specific product that I use to help support my overall health.